Hi guys, Rachael Cook, Doctor of Audiology at Applied Hearing Solutions in Phoenix, Arizona. And in today's video, I'm going to be telling you 5 things that are making your tinnitus louder that you may not even be aware of. Coming up. Nearly 10% of the population experiences tinnitus, a ringing, buzzing, or humming sound that isn't actually present in your environment. Tinnitus is associated primarily with hearing loss and loud noise exposure, but can also be the result of head and neck injuries, disorders of the jaw, and is a side effect of several medications. If you've had tinnitus for a while, then you already know that tinnitus ebbs and flows and may change in pitch or level at times. But while these changes in tinnitus can come from nearly anything, I'm often asked, is there anything that I'm doing to make my own tinnitus worse? That's why today I'll be telling you the 5 things that are making your own tinnitus louder. But before we do that, if you could please take a moment to give this video a thumbs up, it really helps bring videos like these to a wider audience. And if you have not yet already, go ahead and take a second to hit that subscribe button with notification bell so that you never miss any one of our newly released videos. Now, before I begin, I want to point out some reasons why you should schedule an urgent hearing evaluation with an audiologist, including tinnitus in only one ear or that is noticeably louder in one ear than the other, a sudden decrease or worsening of hearing or tinnitus, tinnitus that seems to pulse or fall into rhythm with your heartbeat, a change in hearing or tinnitus after loud noise exposure, or tinnitus that is accompanied by hearing loss, pressure or fullness of the ears, and vertigo. Your reports alongside the results of this evaluation can be used to form a diagnosis or to refer you to a specialist to ensure that there is nothing medically causing the tinnitus that should be treated quickly. Now that that's understood, let's jump into the first thing that is causing your tinnitus to be louder, which is caffeine and nicotine consumption. Both caffeine and nicotine are psychomotor stimulants, meaning that they really supply that get up and go feeling for many people. One risk of these stimulants is increased blood pressure, which often results in an increase in tinnitus perception. This is because the function of the cochlea, your hearing organ, depends heavily on the oxygen it gets from consistent blood flow. Higher blood pressure can restrict the opening of blood vessels supplying the cochlea, limiting blood flow and oxygen and increasing tinnitus perception. If your tinnitus seems to spike at certain times of the day, you'll want to take note of just how much caffeine or nicotine you've already had and adjust your intake accordingly. The second thing that might be making your tinnitus louder is taking common medications. Pain relievers like aspirin, ibuprofen, and naproxen, high-dose antibiotics, loop diuretics, and antidepressants can all increase tinnitus perception. They can become more permanent with higher or more long-term dosages. If your tinnitus seems to increase while taking any of these medications, be sure to talk to your doctor and your pharmacist to see if any alternatives exist for your situation. The third thing that might be making your tinnitus louder is alcohol and salt consumption. Alcohol and salt both change the concentration of fluids within the cochlea that need to remain in the right balance to function correctly. Most people have experienced this unbalanced concentration after several drinks in the connected balance organ of the inner ear, getting off balance or dizzy. But this concentration change can certainly change the behavior of your tinnitus, often resulting in an increase in tinnitus perception while the alcohol remains in your system. Alcohol also changes blood flow patterns and neurotransmitter production in the brain that both definitely impact tinnitus perception. And for many people, high levels of salt can also replicate these effects on tinnitus, seeming to increase after high salt snacks or meals. If a drink or a salty snack after work is a part of your evening routine, make sure to pay attention to the impact that this has on your tinnitus. You can adjust your routine to reduce or remove this habit, or at least benefit from the knowledge that drinking or eating high salt foods will very likely cause an increase in your tinnitus. Oftentimes, just knowing to expect an increase in your tinnitus is enough to remove the negative emotions around a tinnitus spike, making it much less bothersome to you. The fourth thing that could make your tinnitus louder is poor sleep. I know, it's a vicious cycle when poor sleep contributes to tinnitus perception, because tinnitus perception is oftentimes what also makes it more difficult to fall or stay asleep. However, poor quality or inconsistent sleep can increase your stress levels, making it harder for the brain to ignore tinnitus signals. It's no surprise then that your tinnitus may sound louder after a night of poor or very brief sleep. This is especially true with sleep disorders like sleep apnea and insomnia. Be sure to talk to your doctor about any conditions that you find are impacting your sleep. And if you haven't already, make sure you check out my video on sound therapy strategies that can make it easier to fall asleep and stay asleep that I'll have linked in the description below. If your tinnitus is stopping you from falling or staying asleep, then you absolutely must see an audiologist that specializes in tinnitus to evaluate your symptoms and discuss management so that you can get a good night of rest. And the fifth and final thing that could be making your tinnitus louder is by leaving your hearing loss untreated. Nearly 90% of individuals with tinnitus have some level of hearing loss. And if that hearing loss worsens over time, so too can the tinnitus. While you can learn all about why that is in my tinnitus and hearing aids video, I can say that over 70% of people with tinnitus and hearing loss who treated their hearing loss using hearing aids alone saw a significant reduction in their tinnitus. This is likely because returning missing sound information to the brain helps to reduce internal signals trying to make up the difference, especially when combined with counseling and sound therapy strategies like tinnitus retraining therapy or progressive tinnitus management can result in considerable reductions in tinnitus perception. Overall, tinnitus is sensitive to many things. Knowing more about your own triggers can help you to prepare for expected tinnitus changes and remain in control of your feelings towards it. Knowing more about your own triggers can help you prepare for expected tinnitus changes and remain in control of your feelings towards it. Be sure to monitor your intake of caffeine, nicotine, alcohol, and salt and see how your tinnitus responds. If you find that your tinnitus reduces with lower amounts of these substances, then you already found a way to be more in control of your own tinnitus. Talk to your doctor and your pharmacist about your medications and their side effects and see if any alternatives exist. Explore your own sleep habits and your sleep help, and be sure to reach out to a sleep specialist for any chronic sleep issues. And finally, be sure to treat any hearing loss condition you have, whether that's through medical intervention, hearing aids, or both. Managing your tinnitus is totally possible once you begin determining which habits make your tinnitus better or worse. That's it for this video. If you liked it, go ahead and give it a thumbs up and share it with someone that you feel could use it. And of course, if you have not yet already, hit that subscribe button with notification bell so that you never miss any one of our newly released videos.